Hello, I'm Dr. Sai Vigneshwar, consultant physician, Parvathy Hospital, Scrumpet. As we all observe World Hypertension Day on May 17th of every year, the theme of this year is monitor your blood pressure accurately, control it, and live longer. This year's theme primarily focuses on combating the low awareness rate with respect to the blood pressure measurements, as well as to increase the awareness among people. As we all know, knowing the problem is half winning it or solving it. Any blood pressure with a systolic or an upper part having a value of more than or equal to 120 and the diastolic or the lower range having a value of more than or equal to 80 is an elevated blood pressure, and the subsequent elevations we call it as a stage 1 or a stage 2 hypertension. Why we need to be aware of these values? As we always advise our patients to monitor their blood pressures at home with the electronic BP apparatus that's available. Since being aware of these values and the measurements helps you to combat the hypertension. Hypertension is always a silent killer and it can lead to n number of complications, the most common ones being putting you at a high risk of stroke, causing kidney damage, causing peripheral vascular disease, causing heart chamber enlargements, and so on. Instead of being aware or coming to know whenever the complication is setting in, it's always good to act beforehand. So the first step in combating hypertension, or the first step which we doctors advise you to do whenever you find an elevated BP range or a value of more than or equal to 120/80 is start adopting a healthy lifestyle. Always we encourage people to walk or exercise 30 to 45 minutes a day, and the most important thing with respect to hypertension is adopting a DASH diet pattern. DASH diet is nothing but a dietary approach to stop hypertension. So this diet encompasses or encourages the intake of diet which is rich in fruits, vegetables, nuts, beans, etc., and it declines or discourages the intake of a high food that is high in dietary fat, sweetened beverages, or a salt based diet. The third thing is obviously going to be a cut down of your smoking as well as alcohol habits, and the most important thing is going to be a stress free lifestyle as well as a good sleeping pattern. Apart from this, whenever your blood pressure ranges is going to be in the range of more than or equal to 130/80 or more than or equal to 130/90, always consult your physician or a cardiologist and get started on the right medications. Thank you.